of Helen Zimmerman.
Thank you so much. Okay. And let me not spill my water. Oh, they have water up here too. Okay. We have a laser pointer. Okay, but not something that actually goes on the screen. Okay. All right. So thank you all for coming. Happy first night of Passover, if it applies to you. I'm Dr. Ed Zimmerman. We have a 5,300 square foot facility about 20 minutes from here. And we were the first in Vegas to have Sofwave and Pure Impact. How many folks have that? A couple. Okay, so the rest of you are kind of here to learn about it, so we can speak to that. And we are a AAAHC accredited surgical-based facility, so we have sort of a med spa side and a surgery-based side, and the two interdigitate and kind of feed each other. So I am a fossil. I've been around using lasers since the mid-90s, and I can speak to a little bit of historically how the pendulum has rocked from one side of being very invasive and fully ablative to the other side where people don't want any downtime. And so it's challenging sometimes to meet the needs of all these patients, and sometimes it's a stepwise process where we introduce them to the less invasive things and bring them to the more invasive things. So we'll start with that. So we're talking on Sofwave today, and I don't need to be at the podium, do I? Cool, all right. So we can go over here. So I put together a list of objectives, and basically I want you to understand how high frequency, non-focused parallel beam ultrasound compares to other energy modalities, because that's what's going to set you apart in the community. How is this different from the minimally ablative erbium laser or the 1927 thulium or radio frequency microneedling or one of the other things you've got? So I've termed this as high frequency non-focused ultrasound, or what I like to call HINU, and how it can treat all skin types. All Fitzpatrick skin types can be treated with this device. It's basically colorblind, so that's kind of cool. We don't have to worry about PIH, we don't have to worry about TANs, we just have to worry about the human in the equation. And I want you to be able to discuss, with patients how that works and to appreciate their newest addition, which is the Pure Impact. So that's plyometric bioelectrical muscle stimulation. That's the EMS part that we use for toning muscles. So it's basically replaced our M-Sculpt. Okay, so historically, we started out with fully ablative CO2, and then erbium laser came along. So that was Larry David, who was one of my mentors back in the 90s. And excuse me, the problem with it was it had a lot of downtime. So you stayed red for months. In order to get down several hundred microns, you had to get down into the papillary dermis and get heat into the reticular dermis, and that's what gave you the tightening and lifting. And if you didn't do that, you didn't get a lot of result. We got unpredictable white, hypopigmentation, especially along the jawline with that technology, and we still use it in the properly selected patients. Anybody else here do CO2? Not a lot. There's a reason. It takes some experience and a lot of hand-holding. The staff pretty much hates when I do CO2, full face and down into the neck and the décolleté area. And then in the 2000s, we came up with non-ablative technologies. The problem with the non-ablative technologies then is any laser whose energy is absorbed by a chromophore, a target in the skin, so pigment or water, well, it may not have a lot of minimal injury so that it's able to cause healing and skin tightening and lifting and things like that. So the pendulum had to switch somewhere in between, and then they came up with fractional. Fractional laser is pretty cool, or fractional technologies, now we have radio frequency, is pretty cool, depending on where we put it into the tissue. And then, all the way over here, we came up with a fractional technology that treated part of the tissue, but it didn't put any holes in it. So that's what HINU is. That's what Sofwave is it uses ultrasound energy to go 1.5 millimeters down into mostly the papillary, but a little bit into the reticular dermis, without hurting anything underneath and without causing absorption of the fat below that or messing with your fillers below that. So, we talk about correction of color, texture, tone, tightness, volume, contour, and when all those things are needed in order to rejuvenate rejuvenate somebody. And with this is part of our rejuvenation package that we put together. Okay, and everybody lives and dies by their statistics. So ASDS, people are still doing hair removal, but a lot of people, roughly 50% of our patients, are interested in skin tightening, body sculpting, and injectable wrinkle relaxers. So, excuse me, those are all things that everybody in this room does to an extent. Being able to package them together is the key. So that you have patients who have a program. We just, when someone comes in for a consultation, we find out the top 3 things they're interested in, literally design a program of how can we fulfill their wishes and dreams reasonably, and then we work about staying in the budget. So the first thing we do is find out what they want to do and paint the spectrum of things that we can use to fulfill those. This talks again a little bit about erbium YAG, monopolar RF, focused ultrasound. So before we had Sofwave, we had all therapy, and we were the first in town to have that too. And it was a mixed blessing because the focused ultrasound put ultrasound hotspots down the size of a little pinhead down at 3 different levels. So you spent a lot of time making 3 different passes to treat minimal volume. We'll talk about the difference between the two. And we did find that we had loss of subcutaneous fat when we treated the neck and the décolleté. That was a problem because then you had to clean it up, and we didn't really have PRP. We were just getting into PRP at that point. So now we don't have to worry about that because the Sofwave energy goes down just 1.5 millimeters. That's kind of my sweet spot over the entire body, so we do use it off-label for tightening. It just got approved for the arms, but we've been using it for tummies and inner thighs and things like that as well. And I'll show you some pictures of that. So that's where we are now. And you can see that in terms of treatment area, when you look at this, here's the little treatment area we have here. Here's the bigger treatment area we have over here. And with radiofrequency microneedling, we're putting about 30,000 holes in a patient in a treatment at different heights. And depending on which radiofrequency microneedling device you have, you can sculpt the energy field to be more at the tip or to migrate up the needle, or you're still putting holes in the patient. With HINU, you don't need to do that. And so, when we talk about, microneedling, it's basically resurfacing spelled diagonally. We can try to do vector microneedling. We've tried for years to do it. We don't get a lot of tightening along the vector the way we can with Sofwave. So that's one of the advantages there. And none of the radiofrequency microneedling devices have an indication for lifting per se. So if you look at their clearances, with just 250 pulses with our Sofwave, we can put in 4 cc's of dermal coagulation. And when you put that across the face, you actually see some tightening and some lifting. It's non-immediate. You gotta tell patients it takes 90 to 120 days to see your body create new collagen and elastin and hyaluronic acid. Yeah, that's just, you can't mess with Mother Nature. She takes a different view of it. So this is a way that you can have no downtime. Patient can come in, have the procedure, they'll have a little bit of redness, but they can literally put their makeup on. We usually let them take, not put the makeup or sunblock on so the heat goes out, and they start their cosmetics the next day, start all their programs the next day, and they do fine. There's no downtime, there's no holes in the tissue, there's no crust, there's no drainage, there's nothing they have to worry about. And I can combine it with biostimulators. We'll talk about that in a minute. So, I'm literally using microsphere fillers as biostimulators with this to get an even better result. So if you're doing fillers, it combines beautifully with this technology. So my esthetician and I pass patients back and forth all day long. So kind of cool. This is what I talked about with my all therapy device, is I got little teeny dots of treatment areas and went all the way down into the fat. Whereas I have a much bigger treatment area here. Here's the transducer, and it's got 7 big strips that lays down these bands of energy that are fairly large and about twice the volume per shot with our Sofwave devices we have with our therapy. So when you're talking full face, if you use just the 1.5 millimeter transducer on the all therapy and you go to treat, you've got a micro injury volume that's about 10 times higher with Sofwave than you do with covering full face with the competition. So that's why we got rid of our therapy device and went to Sofwave a few years ago. Okay, so here's the video. This is the pretty one. You know, we gotta have toys. And there may be, yep. There's just music with this one, but it's okay. So that's what the device looks like. Apparently they're fairly busy in the booth. The booth is 10 to 20 if people are looking for it, by the way. And this connects with the internet, so a lot of our upgrades are being made just, you know, when we're not there. So it's pushing these energy columns in, and it's right down here, 1.5 millimeters down. It's avoiding the fat and the follicles and all that kind of stuff. It's not hurting any vascular, and you're treating a lot of area on the surface. So you get collagen, elastin, and hyaluronic acid that are all being built by the body. And you can compare it to other technologies. So ablative laser, I put little tiny holes in the tissue, and I can go deeper than that, but you're still putting lots of little tiny holes. I don't have as much area treated as I do with the non-focused ultrasound. Same thing with microneedling. And again, with Sofwave, I can use this technology on any Fitzpatrick skin type. Then here's the old therapy. You get these little pinheads of energy versus bands of energy that I can actually vector and get vector tightening. So there's your comparison. There's your top view. It shows the size surface area you're treating with a single pulse. So it's more efficient and more effective. And so when a patient comes to the office after they've had their consultation, we're going to ask them to come in well hydrated, and we're going to put a topical anesthetic, a compounded topical anesthetic on, and we'll let that settle for about 45 minutes. That's the most that most people need to tolerate a good treatment with this device. And the treatment is a little bit dependent on who's doing it. So you've got to have someone who's handy, who listens to the patient, watches the result, puts enough energy in and pays attention to how they're laying the transducer down, whether they're getting a vectored lift or whether they're doing full face neck décolleté, those kinds of things. We occasionally will use our Pronox with this, so you can use Pronox with this, and the patient-derived analgesia, not anesthesia, so you don't have to worry about meeting anesthesia criteria. It goes out of their system in 5 or 10 minutes. So once they're done with the treatment, they wait around 5 or 10 minutes, have another bottle of water, they can go on their way and they can drive safely. So that makes a difference as well. And this is just the comparison again of the technologies. You can see we're looking from the top, we can see the relative areas treated by each device. And if we're looking down into the tissue, we can see the depth and the relative areas treated. So these are broad FDA clearances. So it's approved for treating facial lines and wrinkles. Now this is not for the person who comes in who's a combination of a Shar-Pei and a California raisin in the middle of the desert. This is for people who have modest wrinkles. You know, you can do a lot with this and with fillers, but even so, some people just need a facelift or resurfacing or both. It is FDA approved for lifting the eyebrow, for lifting the submental area and pulling that back, short-term improvement of appearance of cellulite, acne scars it helps with, and it just got the approval for upper arms. So, and that's getting a lot of attention as we get into the heat. So, excuse me. We've talked about dermal coverage and vectors and non-invasiveness, and again, to pound into the every Fitzpatrick skin type and not having to worry about PIH. That's something that's really cool. There's no other technology I have in my offices like that. And the fact that there's no fat loss to worry about. And it doesn't hurt dermal fillers, so I can combine this with biostimulators every day of the week. Okay, so just to show you some before and afters, and these were some of the clinical studies. There's lots of FDA studies as well as white papers. But more importantly, probably, is looking at the pictures. So when you look here, I think this kind of says it all. Old guy, 12 weeks later. And that's something that speaks highly to patients when they see those kind of results. It doesn't happen overnight, Take digital pictures first so you can really bring them in a month, nothing will happen. 2 months is just starting. 3 months, you're seeing some real improvement. By 6 months, it's pretty much a wow. Plan to combine it with some fillers and toxins to get your best result, because when you put it all together, you get a better result than doing a single thing alone. So for lifting eyebrows, this was the eyebrow submental and neck area. And if you look at the guy, you can see more anterior platform showing here, and on the gal, tightening of the lower ligaments to tighten and pull those lower eye bags back without doing a lower lid blepharoplasty. Necks are getting really nice results, and when you look at, to me, this is a surgical neck, but not everybody wants surgery. So you can do 1 or 2 treatments and really improve that. Then you can use your fillers to sculpt the jawline, lengthen the chin a little bit, and really develop that neck. And then, do a Nefertiti lift with pick your toxin. Put all those together, put a package on it, put your name on it, make it a package. That way people can shop you to be able to go, oh, this is packaged, this is how we do it. This is sculpted by the artist. Same thing here. That's a lot of redundant, curtainy extra skin there. And, to be able to get that to tighten up with, a couple of treatments is pretty nice. And if you put some biostimulator under there, when I use Radiesse and Belafil as my biostims. Radiesse, because it's a calcium-based product, I don't want to heat it up or risk heating it up, so I'll put that in either before or after, but not the same day. If I'm using PMMA, well, the melting point of PMMA is much higher than the melting point of the human. So I can literally put that in the same day if we're comfortable using it as a biostimulator with a 3 to 12 times dilution. So I can relax that, I can take away the pain a little bit. Some of my estheticians like knowing what their pain level is. I don't think you can overdo it. We've never had a burn with this. You could have a blister. We've seen that rarely over the past 4 years. So this has been, a pretty bulletproof technology. And then you have your person who's in their 40s and they've just been laying out in the sun when they were young. So they have a bunch of solar elastosis. They don't have the drapage yet, but they have these wrinkles on the neck and they don't like the décolleté. Put this together with a little photo body, a little IPL or whatever you want to call it. And you can treat the pigmented lesions, the vascular lesions, the texture, and the tightness all together. This is a close-up of one of our studies, the perioral study, and you can see the barcode lines around the upper lip have diminished, and that we were only allowed to do 2 treatments with that, 30 days apart. So I like to put that together with some fillers to get rid of the commissures, treat the DAOs with your toxin of choice, and get a happy patient. You can see again with her side view, much more of the barcode lines, and they're starting to resolve. And these are tough patients, because the lip area has to move well. You can't put a nice stiff filler in there, which is almost what you need to get rid of the barcodes. You can't ablate it because you get hypopigmentation and they don't like the downtime. So this gives us a combination of things in between that really help. Here are arms, and those are a big deal. I mean, we're doing a lot of brachioplasties now that with the massive weight loss patients and the patients on the skinny shots and stuff. And so here, she didn't have a brachioplasty, she had Sofwave, and you do 360, not just over the one area, and it tightens the skin up. It's not a perfect thing. You have to tell them, perfection is the enemy of good. But it gets better, and it does smooth out. And for a month, it's not bad. At 3 months, it gets better. And there's a little tightening. And we use it off-label for tummies. So they get that area of wrinkly tissue over the top of the belly button. They don't necessarily want to have an abdominoplasty. They don't want to put filler in around it. This gives you something else that you can do. Backs of thighs, and we combine this now with our Pure Impact and a few other things that we do to sort of treat the look of that cellulite, but a lot of it's skin laxity. The tush has lost volume, the banana roll's developing, and so they're just getting this drapey skin here. And then we brought in the Pure Impact. We were first in town to have that too. Sometimes being ahead, if the technology, the science of the technology makes sense, being the first in town to have it may make sense because it gives you a little leap on the competition. And then they're snapping at your heels. So the big deal with this is, as people are on the skinny shot, anybody else here doing the semaglutides and tirzepatides, yeah. So people are coming in and they'll lose muscle mass before they lose fat mass. So instead of having them on a program where they get a prescription or they come in and bug your staff once a week to get their shot, we give them their shots at home and say, you're an adult, you take it. But they'll come in to do the therapy that goes with it so they don't lose the muscle mass. And so you put together a program, instead of being paid to use your head and just write a prescription, you're actually doing something. My dermatology mentor from residency used to draw his own bloods on his patients in his derm clinic. And I said, Joe, why do you do that? He goes, well, because I'm a smart guy and I know how to diagnose this stuff, but if I hurt them, if I draw their blood or I scrape a lesion or whatever, it is perceived by the patient as more valuable. So procedurists have always been and are always likely to be paid more. So if you do procedures, the right ones, in your office, in addition to using your brain to solve their rejuvenation problem, you'll do better in life and they'll get a better effect. So we do that. So, and the nice thing about, if you have massive weight loss patients, that's not owned by the dermatologist, it's not owned by the plastic surgeons, it's not owned by the cosmetic surgeons. It's a problem that any physician of any boarding or background can treat, or any provider. So the Pure Impact works for a lot of different people, and as you do those treatments, you've got them under Wynn for 30 minutes, you can educate them about other things that you do in your suite, and that allows you to generate more revenue per patient as you educate them. So we put together a consultation where we talk about all the things that we can do, and each one is tailored to what they have. No two are exactly alike. So the key is cross-conversion. This is the history of muscle stimulation. We'll slide through this because we're running out of time, but basically we had N-Sculpt, and it was fine for getting super maximal concentrations of certain muscles, but it wasn't very natural. And they had EMS technologies where you could put an electrode and you can get an individual muscle to contract, but it wasn't like what Mother Nature does. The pleomorphic contractions are an instantaneous contraction, like when you jump from the floor up to a step. And you actually get better muscle building like that, and you get better reflexes. So the new ones are kind of cool because they're wireless. You don't have to be wired to a machine. These literally attach to the body. We ask them to manscape a little bit if that's necessary. Gals, not, but for guys, we don't want them coming in too furry, so the electrodes will attach, and then they can wander around, at least in the procedure room that they're in. And it mimics real exercise, and you can treat multiple areas at once because there's a whole bunch of these electrodes. There's 8 electrodes available, so we usually put on 4 at a time. And that's what it looks like. So it mimics jump training. It's FDA cleared for strengthening, toning, and firming. The abdomen, the tush, the thighs, and now we just got the arms on that too. So this is kind of what that looks like.
The future of EMS treatments has arrived. Introducing Pure Impact by Sofwave Medical.
And you can go by the booth and they're probably giving samples of this, so you can see what it feels like. I tell people it's like a half an hour at the gym without breaking a sweat.
Using up to 16 wireless electrodes simultaneously, you can offer your patients a diverse range of treatment protocols with no need for adjustments.
And you'll see them twitch, but you don't have to crank it to 100. You just have to crank it to the movement. And then it senses all the different electrodes and triggers the different electrodes, and you can program it as well. There's 3 different ways of programming now. And every time they make an upgrade, they just put it through over the internet, and all of a sudden we have to learn new text. So this has entirely replaced our M-Sculpt at a much more reasonable cost. And the disposables for this are just the patches. They're much more reasonably priced than spending $10,000 to renew our paddles for our M-Sculpt. So I'll go through this. So the paddles will contract lots of different ways, and the machine, depending on what programming you've put into it, will tell you whether you're trying to treat the transversal muscles or the up and down muscles, and so you can get the results that you want to. And so there's basic, there's enhanced, and there's focused. So they can tell you more about that. But just to show you, here's the contraction of the belly. So the overlay there, You can see this guy, you can see the development of the abdominal musculature after 6 sessions. So they can get pretty ripped. We'll see if we can get this guy to rotate. Yeah. So this one rotates, so you can see how the tummy is pulling in. And the love handles are getting better as well. Even the rhomboids are better. And then his before and afters. When we brought this in, we had worked with a company to do some marketing. They have a very aggressive social media stance. And this was a billboard we put out along the 215, got a little attention. And that's what the device looks like if you don't happen to make it by booth 1020, but if you do, tell them I said hey. And thank you very much for your kind attention, and happy Passover to everyone. I don't know if we have time for questions, or if anyone has questions, I'll hang out in the back for a few minutes. We good?
Yeah, we can.